you're familiar with the sometimes debilitating symptoms of sinusitis, you may know a thing or two about the condition. Or do you? I'd like to spend a few seconds talking about the myths of sinusitis. Number 1, if your mucus is yellow or green, you have a sinus infection. Well, actually, the color is determined by the dying white blood cells that are fighting off the infection. That can be due to a viral infection or bacterial infection or the common cold. Number 2, sinusitis is contagious. Some of the conditions that lead up to sinusitis, such as a cold or flu, can be contagious, but the sinusitis itself usually is not. It's not a bad idea to avoid sharing utensils, glasses, or airspace, but generally sinusitis is not considered contagious. Number 3, you need an antibiotic for sinusitis. Well, the reality is that only 2% of sinus infections are bacterial, and many of those will get better with antibiotics as well. So we usually do not have to use antibiotics for sinus infections. Number 4, if you have a constant headache, it's due to sinusitis. Well, actually, sinusitis usually only causes a headache when you have an acute infection. So the good news is you may not have sinusitis. The bad news is you probably have something else that we might have to deal with, such as migraines. And number 5, the idea that the treatment of sinusitis is complicated. Well, actually, the treatment is rather straightforward and simple. First, we try to control the symptoms. If need be, we would use antibiotics, and we only consider surgery if everything else fails. And even so, nowadays, the less invasive sinus surgeries are much easier to recover from than they were in days past. Number 4,